I'm Dr. Allie Benkart at Brown Chiropractic, and today I'm going to show you a couple of trigger points that can refer into the hip joint and very common trigger points that we like to treat here at Brown. So Sierra has volunteered to help me out today with showing you guys some of those spots. The first muscle that we are going to get into is the psoas. The psoas likes to hang out right at the front of the hip joint. So I'm gonna get right in there, kind of palpate along the hip ridge, and then we're gonna go right into this area. So the psoas is gonna come all the way up into that abdominal region as well. And its main job is to flex the hip. So oftentimes if a patient is experiencing any popping, clicking, pinching in that joint region, it may be due to some of that psoas tightness. So along with psoas, we are going to get into some of the muscles of the quad and the adductor, which is kind of towards that like medial portion or the inner thigh. So I'm just going to get right in there and sustain some pressure into the thigh and some of those quad muscles for her as well, which these muscles can all radiate and refer into the hip joint too. And then I'm going to have Sierra flip over onto your belly for me. And another common muscle that we like to get into with hip pain or discomfort are the muscles of the piriformis and glutes. So I'm going to get right into this region. Piriformis is going to help us with a lot of that external rotation of the leg, or bringing the leg outwards. And then glute is going to be responsible for some of that hip motion as well, hip extension. So all of these trigger points and muscles are really, really important when it comes to hip pain, whether it be pinching, burning, stiffness, any of that. If you or someone you know is suffering from hip pain, definitely check us out at Brown Chiropractic.